Hi, Kevin Henry with Dental Assisting Digest, here today at the OSAP meeting in Tampa, Florida, here with my good friend, Mary Govoni. And Mary obviously is one of the foremost lecturers out there on ergonomics. And so we want to take a few minutes today to talk about the top 3 ergonomic mistakes that a lot of dental assistants will make. So tell me what those top 3 are.
Well, number 1 is bad posture. Dental assistants and the doctors that they work with as well. Leaning over, hunching over, twisting their neck, raising their, yes, you should sit up straight, raising their elbows and shoulders when they're working. And it's not so much that you can't do that, you can't sit in perfect posture all the time,
Sure.
But if you sit for long periods of time in those kind of positions, then it's harmful, causes neck injuries, shoulder, back injuries, all kinds of things. Second mistake, and actually the second and third mistakes that the dental assistants make have to do with how they relate with their doctor. That if their doctor's posture is that they're hunching over the patient and so the dental assistant can't see and then they're having to get in awkward posture, they need to have a conversation. Pick the right time, have the conversation with their doctor, and tell them, you know, I've got some ideas how this could be better for both of us, better for the patient, how we can see what we're doing and be more comfortable. And I would even go as far as to say, gee, doctor, I noticed that you're looking like your shoulders are bothering you today, or your neck's bothering you or something. How about we try something different? But many times assistants are afraid to speak up.
Sure.
The other thing I find is that dental assistants in many cases are sitting on stools that are not adequate for them. They're either really old and you can't adjust them anymore, they don't have a backrest on them, they don't have a comfortable seat, and they're afraid in many cases or reluctant to ask their doctors for a new stool.
Sure.
And you know, especially now when the economy's not doing so good, and so they assume that the answer is going to be no, so they never ask the question.
Yeah.
And so if you never ask for the stool, you never ask for something that you need to do a better job, then you're never going to get it. So again, I would pick the time, go to the doctor with some data. What kind of a stool would you like? What's it going to cost? How you could fit it into the budget? But if you never ask, you'll never get it. And if that's what you need to be comfortable and do a better job for your doctor and your patients, then that's kind of what you need to do.
So if a dental assistant's going online to do some research, or talking to a dealer maybe about what stools, what are maybe some questions that he or she should ask?
Oh, great question. The first question I would ask is to see or to look for the stools that have both a body support that comes in front of them and a backrest.
Okay.
That's the ideal type of a stool. And then you look at things like, is there an easy release for the body support so they could get out of the stool quickly and easily if they need to? And what does the footrest on the stool look like? If it's just a very thin ring at the bottom of the stool, it's not very comfortable to put their feet on. There are some stools that have a flattened out bar at the bottom, or something that's a little rounded that may be more comfortable. But there's no one right stool for everyone because everybody's body size and type are different. So the other question I would ask is, could they have a trial of a stool in their office for a week or maybe a month to see if that particular stool is one that would work best for them?
Very cool. So do the research, pick the right time to talk to your doctor, and don't hurt in the office.
Don't sacrifice your body for dentistry.
There you go. Great. Thanks,
Okay.
Mary. I
You're
appreciate
welcome.
it.
Thank you.